Today, we have the extraordinary privilege of sitting down with Rick Shadyac, President and CEO of ALSAC, the fundraising awareness organization for St. Jude Children's Research Hospital here in Memphis, Tennessee. Not only is Rick incredibly passionate and devoted to the mission of St. Jude, but also has a huge heart and love for the city of Memphis. In today's episode, we discuss all things innovation. Rick guides us through some ways he and his team have innovated through this odd and very, very unique season, sharing some valuable wisdom, tools, and resources on how we can find and think creatively outside of the box. Whether it's in our work, childcare, family structures, or even putting practices in place as we navigate this new year, innovation is a must. So let's get to it and meet Rick Shadyac in the Zoom green chair. Rick Shadyac, thank you so much for being with us in the Zoom green chair. I appreciate you being here with us.
Jessica, thank you for having me. I'm super excited.
This is a huge, huge privilege. And I want us today to dive a little bit into your story, and then I really want us to land in a space of innovation. I imagine you and your team have innovated a whole lot this past year. But before we do that, I want to hear about you. And you're not from Memphis, is that correct?
I'm from Washington, D.C. That's where I'm from. But you know, Jessica, it's a really interesting story. So, my family's been coming to St. Jude to Memphis for a really long time. And my dad was one of the early founders of ALSAC and St. Jude. And, my family's involvement goes back to the 1950s, literally. So before there was a St. Jude. And my dad was traveling here all the time. And then, as I grew up and became a professional, I started coming here as a national committee member of the board of ALSAC and St. Jude Children's Research Hospital. And then ultimately I went on the board and became chairman of the board. And then a time came about 12 years ago now, a little over 12 years, I guess it's 12 years, that I was asked to be the CEO at ALSAC. But here's the cool story. When I was still on the board and not living here in Memphis, that's when I got turned on to Hope, because I met Craig Strickland. And Craig was very kind. I would go to church. I would go to your service on Saturday evening in a gymnasium, if I'm remembering correctly. And then Craig and I would go out to dinner afterwards. And he rekindled a spiritual. It was a spiritual revival for me to be around Craig, because he spoke to me. And I just wanted to say that to everybody, because I love Craig, and of course I love the entire teaching team and ministry team, including you.
Thank you.
Just know.
That's great. I didn't know that about Craig. That's exciting.
Yeah. Craig, Nancy Mills. Nancy Mills was the one that connected us.
There you go. Okay, so I love the story of St. Jude. I love the history of St. Jude. I know you have that down pat, but I would love to hear and share with our people a little bit about that story.
Yeah. So, the whole idea of St. Jude actually goes back to the 1930s. So Danny Thomas was, for a lot of people don't know who Danny Thomas is, but the founder of St. Jude was a stand-up comic is what he was. And he was in the 1930s, and he was a struggling actor, entertainer, comic, and he walked into a church. And he prayed to St. Jude Thaddeus. St. Jude in the Catholic faith, that's the patron saint of hopeless cases. And at that point in time in his career, he was struggling. He wasn't sure whether or not he should continue to pursue his passion as an entertainer or he should get a real job. And he went into church and prayed to get some wisdom, because his wife was pregnant with what would turn out to be Marlo Thomas. And he didn't have enough money to make the payment. He didn't have health insurance in those days. He didn't have enough money to pay the medical bill to get his wife out of the hospital. And he prayed to St. Jude, help me find my way in life, and I will build you a shrine. And the truth be told, Jessica, literally the next day, he got a job as a singing toothbrush on the radio, because there was no TV back in those days. Unlike a lot of people that go on to enjoy great success, Danny Thomas remembered his promise to St. Jude, and that promise ultimately manifested itself in the forming of ALSAC, American Lebanese Syrian Associated Charities, which was tasked with raising the money to build St. Jude Children's Research Hospital, and it was going to be right here in Memphis, Tennessee. And what I love to tell people all the time is that this was a guy that had a 10th grade education, yet he had this vision of creating a hospital that would treat the sickest kids in the world, okay? That it was going to be open to kids of all races, creeds, and religions. He was going to put it in Memphis, which unfortunately in the 50s and the 60s was a segregated city. And on day one, he was going to open his doors to kids of all races, and no family was going to get charged for their services. It was going to be free. It was an extraordinary vision by a guy that didn't even have a high school education, and look what we've become today. We lead the way the world understands, treats, and defeats childhood cancer, and it's because of the vision and courage of that amazing founder, our leader, Danny Thomas.
Wow, that's incredible. And correct me if I'm wrong, wasn't St. Jude the first integrated hospital in the South?
It was the first fully integrated children's hospital in
Yeah.
the South. And in those days, literally, this is why it was so important to Danny Thomas and people like my father. Literally in those days, our kids, Jessica, would be turned away simply because of the color of their skin.
Wow.
Okay? They literally were told to go to hospitals that were only for people that were black. And, at the same time, we weren't blessed to have housing facilities. So we didn't have a Target house or a Ronald McDonald house or a Tri-Delta place, soon to be a Domino's Village. We didn't have any of those things. Families had to stay in hotels to get treated at St. Jude. Well, the hospitality industry was segregated back in the 50s and the 60s. And Danny Thomas and our first medical director, Dr. Donald Pinkel, an amazing man who's still alive today, Dr. Pinkel and Danny Thomas told the hotel industry, if you're going to take our white families, then you're going to take our black families.
Wow.
And their first response was, well, we're not going to do that, but, okay, they capitulated and said, okay, we'll allow you to stay in the hotels. But then they said, but they can't eat in the same dining rooms with white families. And then Danny Thomas and Dr. Pinkel looked him in the eye and said, you don't get it. At St. Jude, we do everything together. They're going to dine together, and they're going to lodge or house together, and then they're going to come and get treated together. Danny Thomas was so bold too, Jessica, he picked an African-American architect to design St. Jude Children's Research Hospital, Paul Williams.
Wow, that's really, really neat. And I know you as an organization at ALSAC and even St. Jude as well, we've had a lot of civil unrest happening over the past year. I feel like you guys have done a really good job as leaning into those conversations and facilitating that with your staff, with your organization. Do you mind sharing a little bit about that as well?
I'd love to. Look, we lean into this because, number one, it's the right thing to do.
Absolutely.
Okay?
Absolutely.
And that should always be our moral compass, right? Do what's right. But also, this whole idea of racial justice, racial equality, healthcare disparities, this is in the DNA of ALSAC and St. Jude. I remember speaking one time to Rufus and to the congregation, and Rufus asked me to speak a little bit about that founding principle that underlays ALSAC and St. Jude Children's Research Hospital. And it's a spiritual principle. It's the parable of the Good Samaritan, to love and care for our neighbor regardless, in our case, we expanded it to race, creed, and economic circumstance. And kids back in the 50s and the 60s that were being passed by were kids that had cancer. So just remember, when we opened our doors, kids with cancer had a survival rate of 4%, right? So 96 out of 100 kids, our kids, Jessica, they would pass away.
Yeah.
Right? So today it's 94%. But, kids that were African-American kids had no chance. They had zero chance. And we wanted to say, this has got to change. So this is in our DNA. We're all about healthcare equality, kids of all races, creeds, and religions. But also, we wanted to take the economics completely out of healthcare, right? Why should a mom or dad have to make the most important decision of their life, what treatment to get for their kids, based upon how much money is in their bank account or how good their health insurance is. No mom or dad should ever have to make that decision. And at St. Jude Children's Research Hospital, because of the support of the public, no mom or dad will ever have to make that decision, because we're going to do whatever it takes to get that child better. So that's why this is so important to us. And the cool thing, Jessica, is that we've got a lot more work. Not cool. The compelling thing for me is we got a lot more work to do, because around the world, and I know how Hope is so deeply ingrained with its global mission. Around the world, the single biggest determinant of a child's healthcare outcome is where they live. Because we know that there are disparities in the delivery of healthcare based upon country, where you live. And again, that's not fair. We have a problem that's partially solvable here in the United States. We need to export that knowledge and bring up survival rates all around the globe. And then what have we all learned from this pandemic? What we've learned from this pandemic is that unfortunately there continue to be even racial healthcare disparities in our own country, and it's completely unacceptable. And we've got to do better, and at St. Jude Children's Research Hospital, we want to be the example of how to be way better.
You are, and I just feel like you guys have been leaning into some conversations and allowing your staff. I remember, you guys have just done a really good job as to leaning into those and speaking up, and you guys are doing a great job with that. And
well, we're going to keep it up. And you know what? If you ever find us kind of drifting away, call me on it and call my team on it, because we don't want that to be the case. Yeah. It's fundamentally important that we, especially in a city like ours too, that we try to be that example, so that more and more people realize it's simply the right thing to do, right? And leaning into these difficult conversations. Let's be honest with each other. Leaning into these conversations, it's the right thing to do, and it's good for your business. And fundamentally, you're going to make better decisions. I don't want to surround myself with people that look like me. Okay? That's not the world that I live in. It's not the world that we all operate in. We need to get a diversity of opinion at all levels of leadership in our organization. Actively seek people out. And I'm proud that we've done that. We've got a very diverse workforce and a very diverse leadership team. And, again, it's fundamental to our mission because it's in our DNA.
I love that. I really do love that. Okay, so I want to change gears just a little bit and kind of start focusing on innovation. I mean, come last year, specifically I think mid-March, you guys go and shift to your entire staff is now working from home. Massive things have changed throughout that. I mean, even you depend on fundraising events. I mean, everything has changed this past year. I would love for you to speak a little bit to that. How have you and your team innovated? How are you thinking creatively? I'd love for you to share a little bit about that shift for you as an organization, and then particularly some practical pieces on what you've done.
Sure. So you're right. Our workforce is predominantly working from home. About 95% of them are working from home at ALSAC. St. Jude's has a lot more people on campus because they're delivering health care, obviously. So we had to shift, and we embraced Zoom technologies. But that wasn't enough, obviously, because we still had to raise money. We couldn't just meet. So we had to figure out how we were going to leverage technologies and all of our digital transformation, which we were fairly mature on our digital journey. And Jessica, we either did or were the beneficiaries of over 31,000 in-person events. So we had to figure out how are we going to still engage with folks because we have a mission that is over 80% dependent, and it's a $1 billion nut that we have to crack here every single year. 80% dependent on public support. So we immediately shifted to virtual events, and we tested and we learned. We were pretty bad when we first came out of the gate, but we got better and better. We embraced live stream. We made a conscious decision to communicate, which meant that we ramped up our already fairly robust marketing machine to speak directly to all of our supporters and prospective supporters, to let them know that despite a pandemic, kids were still getting diagnosed with cancer and needed to be taken care of, and that we needed their donations to continue our support. And thankfully, we've been able to turn the corner. Initially, we were forecasting really dire financial circumstances. I had to make a very difficult decision to reduce our force. And it was the right thing to do at the time, one of the hardest decisions, and as a CEO that you ever make. And I care deeply about the people that had to go, but we literally were not conducting in-person events. We weren't conducting campus tours, any activities on the campus. To even today, as you and I are talking, we're now 10 months into this, and we're not doing any of those things.
Yes.
So those were the areas that we've primarily focused on. And then those savings, we invested. Yes. We invested in digital and some of our digital advertising. And I'm proud to tell you that we turned the corner and that we met all the needs of the hospital last year, even in a pandemic year. We're off to a great start in our fiscal year this year. And how do we do it? Everybody at ALSAC is responsible for innovation. So this is not something that's a top-down kind of a thing. Not at all. I'm probably the least innovative person at ALSAC, okay? But what's important is that everybody view themselves as an innovator. And innovation, it sounds a lot more complex than it is. You know what innovation is? It's challenging the status quo.
I like
it's
that.
It's asking the why question, okay? We just ask about any experience. Why do you do it this way? Have you thought about doing it this way, okay? It's about testing and learning. It's about being willing to make a few mistakes and learning from your mistakes. It's about challenging legacy thinking, getting out of your rivers of thinking and thinking differently. Jessica, what I used to tell our team even pre-pandemic was, if you're gonna work for me, you better get comfortable being uncomfortable. You better get comfortable being uncomfortable, because I'm gonna put you in a bunch of uncomfortable circumstances. Why do I do that? I make people that don't want to public speak publicly. Why? We learn the most in circumstances when we are uncomfortable. I know you and your family pretty well. We're comfortable. We can have a conversation. But if I'm having a conversation with someone that I may not know as well as I know the Morris family, I'm going to gear up a little bit different. I'm going to, I'll have a little different. I'll be on my, I'll try to be on my A game today too with you. But you're going to approach a situation differently. You don't learn when you're hanging out with your buddies, right? But when you're with a group of colleagues that are constantly challenging you, you're going to learn, okay? If you put yourself in a certain, as a white male, I want to go and experience God in an African American church. And I've done that and spoken in those churches. And it's uncomfortable. But guess what? I learn a ton when I do things like that. When I do cultural immersions, when I travel the globe and I go and I try to immerse myself in those countries and in those foundations and try to understand what it's like to run an organization on small sums of money and how we can be game changers that way. That's uncomfortable, right? And there's so many things that we just take for granted here in the United States. So that's how we do things here. We challenge each other, we push each other, we surround ourselves with diverse teams. Again, you're going to get different perspectives. We test and learn a whole lot, and there you have it.
I like that. That's really, really good. And I love the getting comfortable with being uncomfortable. Like that is right on. I think that's going to be really helpful for our people to hear that, to be able to push that limit a little bit. Okay, so let's be honest, like we didn't think it's 10 months, like you said, 10 months into this thing. I don't think we thought we'd still be here, truthfully. Yeah. And a lot of us, it's a new year, but it still feels like we're still in the same confines of 2020, right? We're still trying to work through this. Lots of people are still trying to think of how can we innovate? How can we think creatively? How can we continue to be comfortable with being uncomfortable? And so I would love, just kind of ending on a practical note. I love being practical. You know how we are here at Hope. I love being practical. But I just want any practical advice, tips, reminders, things you would want to leave people with today about how do we innovate? How do we continue innovating? How do we keep momentum going, right? I think a lot of us are probably pretty tired, and the idea of innovation seems a little exhausting, maybe truthfully. But how would you encourage or challenge or push people today on ways that they can innovate, very practically speaking?
Well, look, I think innovation is a mindset, first of all. So I would encourage people to be positive. And despite all the challenges in our lives, okay, we all have a lot to be grateful for. You know, if you're getting this interaction, it means you probably have internet, right? And there's other people that may not have internet. If you're choosing to engage in this conversation, you know, you're probably healthy enough to be able to watch you and I right now. There are folks that are on ventilators and are not. There's always people that have things worse than us. So let's focus on the positive, right? Okay. It is a new year. We do have vaccines, and God willing, those vaccines are going to become, you know, massively available, you know, later on, God willing, in the springtime, and we can all then get vaccinated. And we need to encourage people to get vaccinated. Let's focus on some leadership changes that are occurring in the United States and think about potential positive results. Let's reach out to people that we may have some disagreements with and try to find some common ground. We didn't always have to be this divided. And I think if we have the right mentality, then you can start then being uncomfortable. Okay, you get comfortable being uncomfortable, and then you have that conversation with someone that may not see the world the same way as you. But guess what? You like the same kind of music, okay? or you may like the same kind of food, or you may vacation at the very same places, but you just aren't aligned politically. Well, then you're going to start to see a little bit of a different perspective. So I think if we all just kind of take some of those kind of positive steps, you know, I to get started, I tell my staff to do really simple things like, when we all were coming to work, take a different way to work, okay? So you'd go and you might go through a different neighborhood. Well, you'd have an experience about a neighborhood that you might not have known what existed. Instead of having the same darn lunch every single time with the same darn people, have like an ethnic lunch and go with a different person. Don't go with the same people that you go to lunch with every single week or day, okay? Go and be intentional about it. Go and ask somebody to have a beer or a cup of coffee that looks completely different than you. You're going to gain perspective, and that perspective will practically allow you to think in a different way. And that's what innovation is, thinking in a different way.
That is amazing.
Hope that helped.
It did help. It did help. And that is amazing. So any final thoughts, any final reminders you want to leave people with today?
Yeah, I'll tell you one more practical thing, because we laugh about this all the time. So, you know, we're all going to get ready. What's the first thing you want to do when we all get vaccinated and we can get back to being normal? So we're going to all go and we're going to hug our families and kiss and embrace them. Okay, what's the next thing you want to do? Everybody I say, they tell me they want to travel, right? We all got kids, you want to travel, right? Okay. Don't go to Destin, because you go to Destin every single summer. Go someplace different and go experience something completely new. Go experience a different culture. Get outside of your comfort zone. Go do something different, okay? And you will come back, you know, kind of enriched. And so I would just say, really kind of break the mold, and you can do it, and keep positive.
Yes.
And look out, let's just say one more, look out for each other. This is what, Jessica, I've learned so much in this, in this pandemic, the single biggest thing that I've learned is it's so important that we take care of each other and that we be empathetic. People are going through a lot right now. We have to be empathetic, and we have to look out for each other now more than ever. People are struggling, okay? And those of us that have been blessed, and I have been blessed, you know, we have an obligation to do more to look out for our brothers and sisters. So I would just urge everyone to look out for each other, focus on the positive, and be empathetic, because people are going through a lot.
That is a perfect reminder for us as we close this conversation. Thank you, Rick. Thank you so much for being with us today. This is a huge blessing. So thank you. We so appreciate you being here.
It's a privilege. Thank you, Jessica. Keep up the great work.
Thank you. And that is a wrap for our Green Share conversation with Rick Shadyac. Thank you so much for being connected with us today. Don't forget, you can encourage someone today by sharing this conversation with a friend, or watch any previous conversations at hopechurchmemphis.com /GCC, as well as listen on Spotify or Apple Podcast apps. And as always, feel free to email me at greenshare@hopechurchmemphis.com. Love you guys. See you next week.